I want to welcome everyone this morning to our program, Empowering People with Disabilities. I'm Todd Miller with the Brotherhood, and we're pleased to have you all here this morning. And also very pleased to have Kristin Ahrens, our speaker, who's the Deputy Secretary for Pennsylvania's Office of Developmental Programs with the Department of Human Services. And in conjunction with Jewish Disabilities Awareness and Inclusion Month, she is going to talk to us about empowering people with disabilities. Deputy Secretary Ahrens has a deep and broad background in this field and has served in government and was also on the faculty at Temple University prior to assuming her current position. So welcome, Deputy Secretary Ahrens, and we'll look forward to your remarks and then to a Q&A session afterwards.
Great. Well, good morning, everybody. Thanks for joining. And I did put together some slides just to guide the conversation here. But let me start actually with a story that I think will be pretty illustrative of the themes here today. So I'll share a little bit about how I got into this. I've been in this field now for 30 years, have really dedicated my entire adult professional life to this work. And for me, this all started when I was a teenager. Actually, I was 15, and I had a friend who suggested that I join her. She had joined this group with the ARC, used to be known as the Association for Retarded Citizens. There was a youth group. And she said, I think you should come. I think you'd really enjoy this. It's just a social activity, number of young people with disabilities and, a number of young people from our high school. Why don't you come? So I went to this social event and had the time of my life. I enjoyed the company of the youth that I met that evening more than I enjoyed the company of most other youth, and left there frankly feeling very angry. I was 15, so it was easy to anger about anything, right? All of the injustices of the world. But I was particularly angry because I wanted to know, where were these kids the rest of my life? These children did not go to the same school I went to. They were not in our congregation. I grew up Catholic. They did not worship with us. And I felt, because I was 15, that these youth had been kept from me, that there was a great injustice in the world for them being kept from the rest of community, but also for us, that we did not have this beautiful part of our community that had been excluded. So that really, for me, became this turning point. I've obviously become a little more articulate than I was when I was 15 about what all of that meant. But truly, for me, that was a turning point. I started early in college. My first job, when I moved out of home and left, I was in a rural community. So my first job was actually picking corn. But when I left and I was at school, started doing care in a family home, taking care of a young girl who had cerebral palsy. And that really, for me, began this long professional journey that I have dedicated to that idea of inclusion and trying to do whatever I could to both make sure that people with intellectual disabilities, autism, developmental disabilities had what they needed in terms of services and support and awareness for the community to embrace them and for them to participate in community, but also the reverse of that, which is that our communities are richer when we really embrace that kind of human variation, that we really embrace that there is a significant portion of the population that experiences disability in some way, shape, or form, that it is a very natural part of the human experience, and that without embracing that, we are all poorer for it. And certainly that the people who have been excluded because of that are at the other end of great injustice. So a little bit about my beginnings, and I think that'll help kind of guide us through the conversation. So I'll take you through a little bit of history, and then take you to sort of current, and then would love to just engage with you around this topic area. So let's go ahead to the next slide. So one of the things I think will be helpful for this conversation is just understanding that historically there have been a number of paradigms or like ways that we think about what disability is, and those there's historic precedent for that, but though you can still see those exist, and in any given time period you have those all at play. So the sort of oldest concept of disability is really what we would refer to as a traditional concept of disability. Those poor people to be pitied, that's part of it. There's the worthy, the unworthy. There are some religious conceptions around the traditional model of disability that someone had a child with a disability because of a wrong they had done, that was a punishment for that, so that family should be shunned. There was disgrace that should be involved there. So that's very traditional model, very much that model of pity and charity for the people with disabilities. So then the more modern conception that we saw arise in the 20th century was that of I'm hearing an echo, Todd. Oh, I think you took care of it. Was that of a medical model. And the medical model really is that disability is something to be fixed, that there is the person with the disability, there is a professional and an expert that knows about that, and that what we should be striving for is fixing that. And if people don't try hard enough to overcome their disability, then there is something wrong with them. And that professionals really are the experts when it comes to disability. Again, a little more contemporary model in thinking about disability is that of the social model, which is disability is really an interaction between an environment and the person. And it is the environment that makes that condition disabling. So I'll give you the clearest example I think I have of this one is there's a well-known speaker years ago, used to do conferences and whatnot, and had the plenary session of a conference, and he had instructed the event organizer to turn out the lights when he got to the podium. So turns out the lights in the ballroom, pitch black, no one can see anything, and he said, "Now who's disabled?" So really, right, trying to illustrate in that environment, it's literally the environment that is the difference between disability and not. So the most contemporary now kind of paradigm or thinking about disability, and one that I think the disability community certainly embraces more, is that we call the integrated model. This is where we understand that there are medical things that a person may experience some real functional limitations, that there is, the child who is born with cerebral palsy who cannot walk, cannot grasp a spoon to feed themselves, cannot swallow in some cases, and has to be fed by tube, that those are real physical limitations. And no matter what you do to the environment, those will still be limiting. But that the environment also contributes to disability and the person's ability to function in that. So, this is where we also, I think about how where we are, where we build community and society that is more inclusive, it benefits everyone. So take the elevator, right? The elevator benefits the mother with the stroller, the older person with the walker, the mom with 3 kids and grocery bags, as well as that adult with a disability who uses a wheelchair, right? It benefits that whole group. This is, thinking about taking, when we are creating materials to explain things. Let's take the vaccine, the current vaccine, right? Trying to explain the vaccine, the benefits of it, the safety of it, the possible side effects, breaking that down to a visual explanation of that, taking that down to a 4th grade reading level, so that people, even people who have much lower IQs and some functional limitations in terms of cognition, can understand that. Well, that also benefits, the older person who may have lost some cognitive function over time. It also benefits the 16-year-old who hasn't had great access to education. So that's the integrated model, really tries to think about disability in that way, where we embrace the level of variation that we have among humans, take that into account as we create and build the world around us. Okay, let's go ahead to the next one then, Todd. So I'll tell you a little, delve a little bit into the history too, so you have a sense of where, in terms of the disability community, where sort of the issues were, where we came from, and what that means in terms of the current system and current battles that the disability rights community would be arguing. So on the slide, you can see there's an image of a man behind a door. Clearly, this is an isolation room in an old institution. Where the disability rights movement really came from was this history of really extreme segregation from the rest of the community. So in the 19th century, middle of the 19th century through the middle of the 20th century, really, for anyone who needed any kind of care beyond what their family could provide them, the place that happened was in institutional settings. And truly, when we look at members of our community that have the greatest history of being removed from community and put in completely separate settings, it is people with intellectual and developmental disabilities and people with serious mental illness. So there's long history of this that coincides with those institutions, originally were built on concepts and theories about rehabilitation, about what would be really beneficial for these populations, and then it just became truly a way of controlling populations that the rest of society didn't want to deal with, right? So over time, we saw those institutions become overcrowded, underfunded, engage in very neglectful and abusive practices. Then we have lots of exposés, and that begins to change. But the other important thing to understand about the history of the institutionalization is it really was part of a larger eugenic movement, and a eugenic movement that was transatlantic. This was Europe, this was Germany, this was the United States, sharing eugenic practices about the degeneration of races. And during this time period, we saw people who were undesirable, who were institutionalized, were systematically sterilized in these institutions. There were laws prohibiting marriage. There were laws prohibiting people with disabilities. They were called the ugly laws, where people could not be, it was criminalized for a person with a disability to be on the street begging in many cities in this country. So a whole series of laws aimed at cleansing of the population. And again, this was the United States. We don't talk a lot about this. We think of this as happening in Germany. We think of this as happening in Europe. this also happened in the United States. And the individuals with disabilities were a prime target of that eugenic movement in this country. So when we, you can go ahead to the next one, Todd. So when we start looking at then what happened in terms of advocacy, in terms of rights movements, the first real powerful advocacy movements were around getting people out of those institutional settings. In the 60s, you all may remember Geraldo did a huge expose on Willowbrook in New York. That was about the same time that Bill Baldini did a expose on Pennhurst here in Pennsylvania, and really exposed just horrible neglect that was happening of people who were in these institutional settings. So in Pennsylvania, there was a lawsuit that was aimed at remedying the abuse and neglect that was happening in those institutional settings. And what they targeted was that people in Pennhurst, the institution that was the center of that suit, weren't getting any rehabilitation and they weren't getting any education. So what ultimately comes out of all of this is also a deinstitutionalization movement and a right to education movement. Until 1972 in Pennsylvania, young people with disabilities did not have a right to public education. They were excluded from education. So 1974, that became federal law, but we actually had a suit here in Pennsylvania that meant that was happening a little bit earlier here in PA. So you can go ahead to the next one again, Todd. So this is, yeah, if you can just put that chart up for a second so everybody can see it. This is just to show you what the trend line is here. This was the building of public institutions for people with disabilities. And you can see that really peaked in the 60s and 70s. We had in this country, close to 200,000 people were institutionalized in the United States in the late 60s, early 70s. And then from there, that deinstitutionalization movement was quite effective. So I think the exposés that were done really helped shine light on what adults with disabilities, advocates were saying, what parents of people were saying, parents who had no other option. In many cases, they could not care for their child anymore safely, thought they were doing the right thing by putting them in one of these places that was supposed to care for the children. And then the exposés start, right? So you really saw this coalescing of forces. And then we see a pretty precipitous drop in institutionalization. Today in PA, we still have 4 public institutions. We are serving about 650 people in those 4 institutions. So we went from 17 institutions and 13,000 people down to 600 people. In 2019, as deputy, I announced the closure of 2 of those 4 centers, and it is still very controversial. I don't know if any of you caught any of the news around that, but there was quite a lot of news and controversy related to the closure of those institutions, and that is still ongoing. We announced it as a 3-year closure to make sure that we had time to really ensure that each person was selecting a place that they wanted to go and that we could safely transition them all. So we're still engaged in that transition, but it is not unusual as states have tried to close public institutions that there has been controversy surrounding that closure. All right, let's go ahead to the next one. The other thing I think is important to know about the history of this population and disability rights is that out of that deinstitutionalization and right to education movement, there were some really phenomenal advocacy organizations that came out of it.
It's going to escalate and will continue to escalate as we go from February to March to April and beyond.
You muted me for a second there, Todd. I just unmuted myself. So some of those were, for the first time, we actually had organizations that were run by people, adults with intellectual disabilities themselves. So we had out of Oregon and the Northwest, Canada, we had a group called People First. And this was a group of adults with intellectual disabilities who set up a structure where they had people who supported them, but understood that the support meant you help me understand things, you help me make decisions, but I will be speaking for myself, that as an organization, we will be advocating for the things that we want to advocate for. And your job is just to elevate our voices. So it had this really great organization that comes out of the West Coast. Here in PA, we had a group called Speaking for Ourselves. Again, a group of adults with intellectual disabilities who, you can't say it clearer than that, right? People have been making decisions, taking guardianship, professionals are the experts. And this group of adults said, enough. You need to hear our voices. You need to accommodate us to make decisions for ourselves. We don't want to be institutionalized. We want to stay in our communities, and we have the right to get the support we need to do that. So just an incredible group. Actually, the woman who, one of the early leaders, is the CEO today of Speaking for Ourselves here in PA. She was there for the signing of the Americans with Disabilities Act with George Bush. She's just an incredible woman. So Pennsylvania has a rich and prominent role in the disability rights movement, I am proud to say. So some of the things in terms of achievements we had, starting in the 70s, I mentioned we had the right to education for handicapped children, I think was the act now known as the Individuals with Disabilities Act. We also had in the 70s, we had the Rehabilitation Act, which really was the first big federal law that said, if federal funds are going to something, it has to be accessible. You can't have a program that's federally funded. You can't have a building that is federally funded and not meet some accessibility standards. And then we get to the 90s where we did have the Americans with Disabilities Act, and that really was meant to be that playing field leveler in terms of policy. The piece that I think a lot of people don't know is that in the disability community, the other huge legislation that people tout as one of the greatest pieces of disability rights law is the Affordable Care Act. The Affordable Care Act reversed the whole issue about pre-existing conditions, huge for the disability community. If you had a disability, forget trying to get insurance without all of those penalties for having a pre-existing condition. Also, one of the things the ADA didn't include was access to diagnostic and treatment in hospitals. So diagnostic equipment, forget it. If you're a woman with a disability trying to get a mammogram, forget it. Like, there was no requirement that the exam table was accessible, that an MRI machine was accessible, that a mammogram machine was accessible. The Affordable Care Act is actually the first place that got reversed. And then a piece of the Affordable Care Act that ended up not holding was called the Class Act. And this is something that I think we as a nation are going to have to come to grips with at some point. But this was Teddy Kennedy actually had, this was his baby. He had a bill that basically said Medicare and Medicaid when they were created, they didn't anticipate how long people would live, the level of disability people would experience for the length of time over their life. We don't account for that in terms of taxes. We don't have a long-term disability program. And so in the Affordable Care Act, there was something called the Class Act, which really was a national long-term disability insurance program. But the way it was designed, after all the compromise, they couldn't figure out, the actuarials came up with a very high price that would have to be taken out of a paycheck. And so they dropped the whole thing. It is something we're going to have to reckon with as a nation. But again, the point of this is, I think there is some extraordinary policy that was in the Affordable Care Act, which is why when the debates were happening a couple of years ago in Capitol Hill, you may remember that during the hearings, you had people with disabilities, you saw them out of their chairs, on the Capitol steps, out of their chairs in front of senators' offices. They were some of the loudest voices. And that is precisely because it is such an important bill in terms of access to needed services for people with disabilities. All right, Todd, I think I have maybe one or two more slides here. And we can, after this one, we don't really need to go to the slides, and I'll stop so we can just have some conversation. So where we are now is the Office of Developmental Programs is within Pennsylvania's Department of Human Services. And we serve about 57,000 people, all ages, with intellectual disabilities or autism. We primarily do that through home and community-based services. We built, as those institutions were closing, we built a community system of care, and that system continues to move toward better supporting people to continue living with their families. So we have group homes, we have sheltered workshops, we have those day programs, but 80% of people actually live with family. And that's where we are trying to support people, is to stay with family, to live in their own place, to never be really separated from that. So that's been the focus of our service. We're down to less than 5% of our population that gets any kind of service is served in an institutional setting. Our philosophy at the office, and I didn't create this preceded me by many years. In 1991, our office adopted this philosophy of everyday lives. And the concept here is that people with disabilities have the right to an everyday life just like anyone else in the community. With all of the mundane things that happen in everyday life, that is what people are asking for, right? I want that job. I want to live with family. I want to be married. I want to have friends. I want to go to swim class. I want to, go picnic at the local park. I want my house to have the accommodations that it needs so I can get in and out independently. It's everyday lives truly is a two-word vision of what we're trying to do here is people have the same opportunity to live, play, work, worship as anybody else, and that they get the service to do that. So why don't I stop there? I know we wanted to make sure there was plenty of time for conversation, and I can certainly talk a lot more specifics about what our office does, but would love to just have more conversation here.
Well, thank you, Secretary Ahrens, for the most informative presentation. I'll start the question by asking, what can we as citizens do to help people with disabilities integrate better with their communities?
So I think the first part really is that kind of the understanding and meeting people where they are and taking the time and patience. So if you are organizing things, just thinking about what anyone might need to fully access that event, to access that material, to enjoy whatever activity you've engaged in. Some of it is just, I think, thinking more inclusively about who all of our community members are. Some of the other things that I think are really critical. So a couple of areas that we're very focused on for our population. About 30% of people that get services from us can't tell you, they can't communicate with you in words. So they have no effective way to tell you with words what is happening or communicate with you. Some people have devices to help them. Some people, I've worked with a gentleman who used eye gaze. So you could ask him a series of questions. If you had to be good at asking yes and no questions. He would look at his left knee for no, his right knee for yes. And it was always fascinating being out with him in the world, because there were people that would immediately just talk to his caregiver. They wouldn't, if he was in a restaurant, nobody was asking him anything. They'd talk to the caregiver. What does he want? And then there were the people that, with the small bit of instruction for how they could communicate, would take the time to do it. And that's really some of it. I work with a number of the adults in our advisory committee are very hard to understand when they speak. And we'll tell you how frustrating it is when people are like, like they pretend they've heard, they pretend they've understood, or they turn to the caregiver and ask the caregiver. I have one gentleman who I've had to ask him, and I've known him now for years, so I'm pretty good at understanding him, but if he's tired or I'm tired or both of us are tired, I may have to ask him 5 times to repeat himself, or ask him several times, say what I think he's trying to communicate to me, and then check back in with him. And he said, I would rather do that 20 times than for you to pretend you've understood me. And for him, he said, just taking that time to showing the patience and showing the respect to do it is really the game changer there. So I think some of it is just, honoring people in that way. When you see people out with caregivers, when people attend things with caregivers, always acknowledging that person. That's huge. The other thing is people really want to work. Like, we have our employment rate, not unemployment rate, our employment rate. And I would be proud of this number, because this is the national situation we're in. We were up to 17% employment for our population, our working age population, pre-pandemic. And that was a huge accomplishment. We were at 12% for many years, 12 or lower. We've been doing all of this work to try to get people into jobs. So if there are, if you own businesses, if you work in businesses, if you have any influence on people in HR, it is trying to build those opportunities for employment. Employment is what gets us out of poverty, gives us meaning. It is how people, so many relationships are built through employment. So I think, for our population that works or wants to work, they're very, very passionate about that they've been so excluded from this. Sheltered workshops, we still are pretty reliant, unfortunately, in this country, in most states, not all states. Some states have closed them down entirely. But we have a number of sheltered workshops in Pennsylvania. And we purposely haven't closed them down. We need them to transform how they support people. We have about 18,000 people that attend some kind of day program or sheltered work in any given day pre-pandemic. That's a lot of people. That's a lot of people that rely on that. That's where they have belonging. It's part of the routine. It's what makes sense for their families in a lot of cases. It's how a family member is going to work. So as a Commonwealth, we said, we can't just shut these down. Like, we have to work with the providers, work with individuals. And some of those providers have been really good about helping those people transition to employment in the community, wrap some other services around them. But part of this is really shifting our thinking as communities around employment, around who is a valued employee, thinking about the kind of work that's done in businesses. We have some very successful job developers. That's an occupation in our field. It's people who go work with businesses. They work with an individual who's looking for a job. They work with businesses to try to pair those things, because sometimes there's a lot of accommodations that will need to be made on the job. One of the things that we have some people who've gotten very skilled at are looking within a business for all the sort of odds and ends that you have other employees, full-time employees doing, that make them less efficient in their jobs, and sort of piecing together a position, a customized job, and then bringing in a person with a disability to do that customized job that makes everybody else more efficient within that business. So there's all sorts of models for how to look at this. But if you have any influence in your world related to helping people with intellectual disabilities and autism gain employment, that is just a phenomenal area that has benefit in terms of self-esteem and, and competence in this world. Again, money, belonging, all of those things that employment can do for us. So those are a couple of the big areas that I would say.
Okay. All right, Bob Bernstein, you had a question. Feel free to ask it.
Yep. Secretary, thank you very much for your time with us, and thanks for what you do. I want to ask about barriers to entry. Just an anecdote, we live in Squirrel Hill, and my wife and I use a mobility scooter, and we spend a lot of time walking around the business district. And a couple of years ago, there was a small business that expanded into a new location and was required to put in an accessible restroom. It was a food service business, mostly takeout, but was not allowed to ramp its front step because it would have interfered with the sidewalk. So there's an irony, and ironies aside, we do have a couple of situations in our neighborhood where new businesses have opened in existing locations, and there's a step, and which makes it impossible for us to get in. How is that allowed these days? How can that happen in the city of Pittsburgh and in Pennsylvania?
So I am not the best person to talk about the nuance of those accessibility laws. You do have a great resource in Pittsburgh related to that, though. So there's one of the on the slide I had a note. One of the key laws, the Americans with Disabilities Act, is one of them. There was another law that was passed in the late 60s called the Developmental Disabilities and Bill of Rights Act. As part of that act, Congress has funded since the late 60s 3 sort of sister organizations in every state. One is a University Center for Excellence in Developmental Disabilities, which is Temple, which is where I worked before I came to the state. So research, disseminating information, all of that. A protection and advocacy organization, which in Pennsylvania is called Disability Rights Pennsylvania. They have offices in Pittsburgh, Harrisburg, and Philly. They do statewide work. And I know they very specifically have addressed that issue. I know they took some cases in Philadelphia, and they have attorneys that look very specifically at ADA, the sort of physical site accommodations and businesses. So I know there is a lot of nuance about sidewalks and about historic buildings and ways that businesses have managed to get around it, including pools, hotel pools, until 30 years later, finally somebody started enforcing the Americans with Disabilities Act that hotel pools had to be accessible. But the folks with disability rights are the people that I would definitely suggest talking to about that. The third one in that other act, by the way, so I finished that thought, is called the Developmental Disabilities Council. And they're basically a grant-making organization in Pennsylvania, and they've done a number of projects where they have looked at sort of demonstrations and piloting things, many of which the state ultimately has adopted. So that that bill that passed in the late 60s has really changed the face in terms of rights, in terms of continual innovation in services.
Thank you.
I saw a chat up here too, Todd. Did you see that?
Yeah, well, I'll have part of unmute them. So Paul Pitts, Lori Rabin, if you have a question, you can unmute yourself and ask it now if you like.
Okay. Hi, I'm Paul Pitts, and it's my wife. I was part of the deinstitutionalization in Allegheny County. I worked for one of the community mental health centers. And just a comment and observation, when this was the residential programs, and we would go to the, like particularly Marcy State Hospital, but some of them that we were working to bring people out, we would interview and talk to the patients, talk to people, and they would say, most of them said they wanted to come out into the community. Mm-hmm. They wanted to live the everyday lives. It was very moving. Some were frightened, mm-hmm. longer. And then the other thing I remember was one mother of a woman had, when her daughter was younger, the doctor said, put her in the state institution. She said it was like a death.
Yeah.
When we talked to them about coming out, she said it was like a death again. It was such a change. It was very moving to be a part of that, breaking people out into the world.
Yeah, it is really, really difficult for the state centers. We have people that have literally lived in Polk and Whitehaven, the two centers that were closing for 70 years. Right. It is literally the only world they have known. Mm-hmm. So, for them, for their parent, in some cases where, the parents are still alive, they made that very difficult decision that many years ago. The doctor told them it was the right decision. Everybody told them it was the right decision. And so to relive that now without any understanding of what the community system looks like, what any of that looks like, is terrifying. And so we have a number of people that I think will just transition to one of the other state centers, and that's an option. They can do that. That's fine. And others who are very eager. Some lived in community until they were in their 20s. Some had that experience of community. Some didn't, but they see what it looks like when they're out, and they very much want that. So we want to make sure it is an option for everybody who wants it. The others who don't, we have ample space in the remaining centers. But thanks for sharing that. It is all of it is very heartbreaking, mm-hmm. for sure. Yeah.
Right. Dorothy Gordon, you have a question. Feel free to ask it.
Hello, everybody. First of all, Secretary Ahrens, thank you for being here. I just sent you a private message. You and I communicated back in 2019. I work for Amerikey with Terry McNellis.
Oh, okay.
And we communicated that we were in the midst of a program transformation, which is a lot about what you're talking about. And you and I communicated when we were having some community groups that we certainly hope to get launched forward again once all of COVID is behind us. And it's been a really tough year, almost a full year. But what I give tours to people when they come to visit. I work on the business side, but on donations, fundraising. And we talk about that time when families made that really, really tough decision. And it was to have their loved one and sometimes forget about their loved one. And it was better for the families. And we always talk about, it was just a different time, and we have to take it in the context of the time. I'm not forgiving the eugenics, and that was horrible. But one year I got a donation from a family member and a bequest saying, "You saved our marriage. Your organization saved our family." Mm-hmm. Because they didn't know what to do. The doctor said, "This is what to do with your loved one." I'm glad it's a different time now. That's for sure. But you know, there's so much more that can be done, but we always talk about when I'm giving a donor a tour and they're not involved in the disability community, they may be a foundation that might be interested in funding us. I'll always talk about family involvement so much more now, because in the 60s, that's what the people were told to do. And
well, there was nothing.
right.
There was nothing. And now we have, you know, starting with early intervention, we have, you know, just, and Pennsylvania is a very generous, our benefit package through Medicaid is very generous for children with disabilities. We have a waiting list. That is part of the remaining institutional bias, is that you can still, if you say you want an institution tomorrow, you can still get one. And we have maintained waiting lists for community services. But for the people who sort of rise to emergency level, we get them into service, and we have respite for families. We have family counseling. We have the in-home service. So if it's a matter of you have a parent who can't, or it doesn't make sense for a parent to be bathing their adult child anymore, either physically or just emotionally, that you can have a caregiver come in to do that piece. Family life continues on in all of the other ways, but those pieces that family can't do anymore, that now doesn't mean that somebody has to be institutionalized. And that wasn't the case in the 60s at all, or the 70s, even into the 80s in many cases. So
It just makes us wonder what it will be in 20 years from now. So
I would
exciting.
love to see it. Yes,
Yeah.
it is. It is. Well, thanks for sharing that, Dorothy. Appreciate it.
Thank you. Thank you
All
for
right,
being here today. Really appreciate it.
Lisa Lederer, feel free to ask your question.
Sure. Well, thank you so much for this talk. It's been just, like, absolutely fascinating. I had a question about the language that we use surrounding disability. Like, I think kind of we've all heard of person first language, but just the nuances, there are so many controversies about, for example, I know that some people who are autistic actually prefer to be called to be called autistics rather than people with autism, because that connects with the whole Mad Pride movement. And I was just wondering, do you have any kind of rules of thumb about what language is appropriate?
So, Lisa, this is a brilliant question. I love it. And you've nailed where we are, I think, at this moment. So we went from disability rights, and I just kind of breezed over this because I was trying to get done in half an hour, but we really went from, you know, this place where we are trying to get people out of segregated settings, the idea of everyday lives, that people can participate, will accommodate people, to what we have now, which is a very loud disability pride movement, which says it's not just about accommodating us. This is about assimilating and looking at what beautiful things the diversity of our experience brings to communities, and that actually you all need to change too, right? So it is, there is a huge neurodiversity pride movement. I have a friend whose Twitter and Instagram handle is NeuroWitch. She's just, like, she's, you know, super proud of all of her quirks and the fact that neurologically her brain works really, really differently. And she's, you know, she's an amazing woman with an amazing brain, and she has taught me so much about the world around me. So it's a perfect question, because I think you do have people now who physical disability, that advocacy community for probably 2 decades now, they'll tell you they're Crips, right? So they're like, they will talk about, and they've taken back that name, right? You can't sit calling somebody a Crip from that community is like, yeah, I am. And I think we're seeing that come out of the autism community as well, which is fantastic. And same with people with serious mental illness. People are embracing that what they bring to the world, as much of a struggle as it might be sometimes, and how it makes them different, that difference is to be treasured. So it does make language tricky. We have from the intellectual developmental disability community, calling people disabled, calling them a disabled adult, they come from a history where all of those words were absolutely used as insults. The word retarded, you say that word now and people, they shrink or they're in your face angry because it was such an insult. So you have sort of these different disability communities who, and the blind and deaf communities too, huge pride movement. So they will tell you they're deaf adults, they're blind adults. So you have this balance, and certainly I end up in the middle of that a lot because of the population that we work with at ODP. The rule is start with person first language. So person with a disability, person who is blind. And if you're in a group that they are referring to themselves as autistic and disabled adults, then feel free to shift your language to accommodate or ask. There isn't, you will be in a position where I've been called out on it, where I've kind of shifted to acknowledge it, and then I use the opportunity to have the discussion. And as you can tell, I can talk, so. It's a great question.
Thank you so much.
Yeah.
Are there any other questions? If so, please unmute yourself and ask the question. Okay. All right, well, thank you, Secretary Ahrens, for sharing your time and expertise with us this morning, and thank all you participants for the questions that you asked. And oh, I'm sorry, is there another question before we sign off?
Yes. Okay. I've unmuted. This is
Yes, we can hear you.
okay, great. This is Lori Rabin. This is a comment. And I'm involved in the organization Jewish Residential Services. And I just would like to comment on the other part of everyday lives, which includes helping people with disabilities of any kind move to independent living.
Mm-hmm.
And that is something that we are very devoted to, our work to make available and to be involved with other organizations to make available apartments with some supervision. We're just opening a third home for people with profound disabilities in the community. That's our, they're right in Squirrel Hill. So I just wanted to add that to the thinking here. And thank you for your work and for your presentation.
Oh, thanks. Well, and I'm thrilled to hear that. We actually have in the governor's budget, we have been doing a lot of work to try to be less reliant on 24-hour licensed group home type settings. And we have in the governor's budget, hoping that the legislature approves it, some money that will allow us to incentivize transitions from group homes to supported independent living or life sharing models. So so there's one other thing you could do is advocate that the legislature passes the governor's budget in spite of how terrible this budget climate is because of the pandemic. Governor Wolf has a very large waiting list initiative in it again, which would allow us to bring about 830 more people into service. And then it also has this incentive for exactly what you're talking about, Lori. So thank you. And please advocate for the governor's budget.
I'd like to say something real fast. I'd like to thank Brotherhood for their commitment to have a Brotherhood brunch during Jewish Disability Awareness and Inclusion Month that brings these issues to our attention. There's nothing in bylaws that say Brotherhood needs to do this, and we really greatly appreciate the time and energy that Brotherhood puts into making this happen. The last event that is happening that is sponsored by Temple for Jewish Disability Awareness Month is a Moth-like radio show that Lisa Lederer is putting on. It will have about 8 different people talking about their experiences with disabilities, whether they personally have disabilities or their good friend did, and they'll all be personal stories, and it's going to be emceed by Alan Olson, who is the Moth person here in town. And Lisa, I don't remember the date or the time.
Sure, it's Sunday, February 21st at 2 o'clock. And it should be a really interesting kind of panel of stories, and Alan is a great host. So, very funny.
And the last event that's major in Pittsburgh is Matan from Real Ability is coming in. It's being sponsored by Jewish Residential Services and Federation. I want to say, I don't remember the date. I'll look up the date and come back to you, put it in the chat.
All right, thank you. I'm sure that we'll be getting information for this week at Sinai e-newsletter, so you can look for information through that channel. All right, well, again, we appreciate your time and expertise this morning, Secretary Ahrens, and appreciate all of you being here. Our next Brotherhood Brunch is going to be on Sunday, April 11th. Speaker will be Rabbi Josh Weinberg, who's the Executive Director of Arts of the Association of Reformed Zionists of America. We'll be talking about how liberal Jews can strengthen their ties with Israel. So again, thank you for being here this morning in observance of Jewish Disabilities Awareness and Inclusion Month, and enjoy the rest of your Sunday.
Thank you so much for inviting me. Thank you.
Thank you.
Thank you for being here.
My pleasure.
Thank you.